News 743, a 6-member team of Boston University School of Public Health Fellows take on incomparable scopes of work to support a public health association in Afghanistan. Join us now to learn about the efforts of this group to promote health in Afghanistan through policy and advocacy. Boston News 743 starts right now.
Good evening and thank you for joining us. I'm Nadia Shimini.
And I'm Maura Susi. We have breaking news out of Afghanistan tonight. After decades of conflict and subsequent disruption of healthcare services, Afghanistan is ranked among the lowest in terms of health outcomes worldwide. It has one of the highest maternal mortality rates and the highest death rate for infants in the world.
To help combat this dismal state of affairs, the Afghan National Public Health Association was formed in 2009 by a group of voluntary medical professionals to advocate for health initiatives in Afghanistan. ANFA is a non-for-profit, non-governmental association which partners with various stakeholders, including the Ministry of Health, to reform the country's health system.
Any undertaking of this size requires a massive effort. To aid ANFA in their mission, Hayat Consulting Group has been brought in to assist. They're making major waves over there in Afghanistan by supporting ANFA with human resource management, quality improvement strategies, health management information systems, pharmaceutical supply chain logistics, and financial management.
I believe we have a clip obtained earlier by our field reporter Eleanor Kingsley regarding Team Hayat.
I've just caught Kristen Appa, TA for IH743. Kristen, what's going on in Afghanistan with the Hayat Consultant Group? What's Hayat doing in Afghanistan? What are they doing?
Stay tuned for the remainder of our program for more information on Team Hayat and ANFA. We return to Eleanor Kingsley, who caught up with 3 members of the team. Eleanor? Thank you, Maura. I'm here now with experts Caitlin, Christina, and Kelly to discuss financial management and human resource management. Now, I have no idea why anyone would want to specialize in these fields, since even just saying them aloud makes me want to keel over. I'm so bored.
Well, Eleanor, we think that financial management and human resource management is the most important aspect of program implementation, specifically because if you think you want to keel over and die, you can quickly say goodbye to your organization.
Absolutely. They underpin everything an organization does, like carry out its mission.
I mean, really, Eleanor, how can you expect to cultivate your employees or monitor your finances without these 2 important aspects of programming?
Yeah, that's why this is the most glamorous part of program implementation, actually.
Okay, so can you tell me specifically what you did to aid ANFA in these functions?
Sure. For human resource management, we did an analysis of 3 other public health associations to define the types of roles that they should be including in their organization. You know, you really don't want to hire a graphic designer if really you need an accountant. So what we did is we wrote the first job description for the first newly hired position at ANFA, and we wrote a funding strategy for that person.
Okay, yeah, sounds straightforward.
It actually took a lot of creativity, Eleanor, because according to Afghan law, ANFA is classified as a social organization and they cannot accept any international funds or grants, so we had to be very creative.
I see. All right. And Kelly, what did you do to aid their financial mission?
Right. So first of all, we did a thorough analysis of what other public health associations, how they currently manage their finances. We found a variety of different answers, but the most important thing was that whatever your software package you're using or system you're using needs to be a good fit with your organization. So to understand what ANFA's needs were, we conducted an assessment with them, particularly around accounting, budgeting, cash management, and auditing. And based upon their needs, we determined that Quicken software was actually the best recommendation for them. You may think that Quicken sounds very basic and not extravagant, but I mean, Eleanor, we couldn't suggest something huge and grandiose for an organization like them. They would just be throwing their money out the window, and what kind of experts would we be if we recommended that? I mean,
Okay, Christina, now can you comment on how easy this entire process was and whether ANFA will even use any of this stuff?
Absolutely. It was not easy. We had to work very hard to put together this financial management package. In fact, the information on the other public health associations was not easy to find. We had to reach out directly to, 20 different public health associations. And furthermore, two of Hayat's very own happen to be disaster relief experts, internationally renowned, and their services were desperately needed at the time we were putting together this report. However, because we all go to sleep at night dreaming of balanced budgets and perfectly balanced accounts, it was no problem to pull together. And furthermore, is ANFA going to use it? Absolutely. This is going to poise them to make an impact in public health policy in Afghanistan and change absolutely everything based on these two recommendations.
I see. All right. Well, this is Eleanor Kingsley, back to you in the studio with this fascinating expose on financial management and human resource management. Back to you, Nadia.
Wow, moving stuff, Eleanor. Let's move to the weather.
Well, hi, I've got y'all's weather tonight, and so it's going to be a big one, y'all, because we've got a big warning in effect because it's going to rain. So right now we're in Kabul, Afghanistan, and so, there's some, Afghanistan is on here somewhere, and so it's got rocky terrain, lots of dirt. It's raining quite a bit, so y'all need to bundle up. Super cold, so wear your turtlenecks, stuff like that. And and then it's going to be each day really cold, then a little bit cold, and then a little bit warm, or not so cold. So yeah, but you can see it's going to rain every time. So y'all just be careful, alright?
Ms. Sabira Turkmeni has worked closely with Team Hayat and can tell us more about this team's efforts in Afghanistan. Let's go now to an interview with her in Kabul with our field reporter, Eleanor Kingsley.
Ms. Sabira, it's a pleasure being here with you in Kabul today. Can you tell me about your relationship with ANFA and Team Hayat?
Yes, actually, I'm the president of the Afghan Midwives Association, and we're a partner organization that works closely with ANFA, and ANFA has delegated Team Hayat to work with us on quality improvement.
And what did the AMA ask Hayat to do for them?
Well, first of all, the Afghan Midwives Association, the AMA, has helped establish the Midwifery Education Accreditation Board, which ensures the quality of maternal and child health services in the country. The problem is this board is voluntary and entirely dependent on donor funds. Is only able to accredit hospital and community-based midwifery programs and really needs to begin to include the private sector midwifery schools into the accreditation process. So we asked Team Hayat to help institutionalize the midwifery education accreditation process in order to accredit all midwifery schools in the country.
Wow, all of the midwifery schools in Afghanistan?
Yes, all of them.
Wow, that must have been a challenge. So what did Team Hayat produce for you?
Well, first they created a process map of the midwifery education accreditation process as it currently stands in order to find bottlenecks in the process that could benefit from quality improvement interventions. But mainly the most important thing that they suggested for us was a quality management roadmap, which enables us to sustainably accredit all midwifery schools in the country. This roadmap was spanned over 5 years and in 3 phases: planning, and then 2, establishing this council, and then 3, maintaining the autonomy of this independent council.
And how did you like working with Team Hayat?
I think working with Team Hayat was really great. This consultant team gave great recommendations suitable for our organization's capacity, and I definitely would recommend other organizations to hire them in the future.
Well, thank you for meeting with me, Ms. Sabira, and back to you in the newsroom.
Thank you, Eleanor, for that in-depth report. We've just received information from an anonymous source that the Afghanistan Ministry of Health only has information on the basic package of health services from the public sector.
In order to really understand the health status of the country, information from the private sector needs to be incorporated into the health management information system. This is one complex problem. How on earth will Team Hayat pull through this one? Let's find out. We'll take you to Eleanor Kingsley, who has that information for you tonight.
Thank you. I'm here to report on the joint initiative between ANFA and the Hayat Consulting Group in order to propose a system of private sector data collection for Afghanistan to incorporate with the health information system. And the goal here is to be able to incorporate data from both the public and the private sector into the health information system. The Hayat Consulting Group have announced that they plan to analyze data from both the public and the private sector and make a recommendation as to which level and which data in particular should be collected from the private sector first. They've also announced that they plan to use the ComCare mobile health technology in order to accomplish this. This unprecedented project is in response to a call from the Minister of Public Health. Okay. Wait, I'm getting some breaking news. There's a hostage situation. It appears that the M Health Report is being held hostage. Let's go to the Hyatt headquarters and find out what's happening. We're here at Hyatt headquarters. Let's find out what's happening. I'm here with Lindsay Little, the team leader, who is desperately trying to reach one of her own team members in order to get the missing pieces of a report that's due at 5 p.m. today that are being held ransom. Lindsay, how are you feeling about this?
I mean, I don't know what to do. I mean, I've been calling her, I've been emailing her, I've been texting her for hours. I mean, we have a report that's due at 5 o'clock, it's 4:56, and I can't get a hold of her.
Is there anything you'd like to say to Nadia right now?
Nadia, just please give me the report, okay? I'll do your citations for you, please. Just don't hurt the report, all right? Just please give me the report. Please give me the report.
Wait. I see that we have Nadia on the line actually right now.
What?
Hey Lindsay, I just got your message. I was sleeping. I will send you the report now.
Okay. Wow. Well, that was a close one.
Well, that was a close call, Eleanor. I'm glad Team Hayat was able to overcome that.
Indeed, someone should get that girl some coffee or a pager. Now, onto the top story of the evening. Grammy winner Lindsay Little was arrested early this morning by Afghan officials after her tour bus was searched at the Pakistani border. The infamous pop star was on her way from a concert in Karachi to her next tour stop in Kabul when the police found counterfeit drugs hidden in the undercarriage of the bus at a routine border screening. Was she an innocent and unknowing drug mule as she claims, or is she directly involved in an Afghan smuggling ring? We may never know. We go now to the field where we have footage shot late last night at the border.
Don't you know who I am?
Come with me. Come with me.
The prescription!
Let's resume our coverage of Team Hayat's effort in the realm of pharmaceuticals. They've been tasked with assessing the quality of drugs available for sale in Kabul and determining what to do with the assessment results. During the course of this work, they received several threats from yet-to-be-identified counterfeiters and smugglers, highlighting just how dangerous this type of work can be. I'm standing in front of the office of Warren Kaplan, an expert in international pharmaceutical affairs. Let's go inside and see what he has to say. Do you have a statement regarding pharmaceutical stakeholders in Afghanistan?
Well, Maura, I got to tell you the truth. It's people get killed over pharmaceuticals and drugs in Afghanistan, so I'm not really prepared. I'm reluctant to do that right now.
I'm back now with an anonymous source to continue my expose on international pharmaceutical affairs. Let's see what they have to say.
Well, it's really important to know who the stakeholders are, even in Afghanistan. It's very complicated, but it's important to know who they are, what their strengths are, what their positions are. Notwithstanding, it is dangerous to figure all that out, but without knowing who the stakeholders are, you can't provide an effective policy of any sort. So it's critical to understand the agendas, the sources and the strengths of each one of the stakeholders.
Clearly, stakeholders are important to consider when performing a drug assessment within an entire country. Ultimately, Team Hayat developed the assessment protocol for all of Afghanistan to determine the quality of drugs available for purchase there. They also came up with a dissemination plan and a stakeholder analysis. To finish out our coverage, we return to you in the studio.
What a terrific job Team Hayat has done consulting for ANFA and its partner organizations. It sounds like ANFA, the AMA, and the Ministry of Public Health are well positioned to grow and make the impact on public health they hope to achieve.
To wrap up, here are some closing thoughts from Team Hayat on their work for ANFA.
Don't be afraid to dig into the details.
Clarify your scope of work early.
Manage your time.
Definitely have a backup plan.
Don't be afraid to ask clarification questions. So this semester as a team we survived a blizzard, incredibly difficult scopes of work that would have made anybody cry. We cried. And a major citywide disaster. But as a team we were able to stay together and not unravel, and that's because of the incredible characteristics of leadership that each one of our members displayed.
Thank you and good night.